All right, engineers, in this video, we're going to talk about the accessory nerve, or cranial nerve 11. So what are we going to talk about in this video? We're going to discuss in this video the origin of the nerve, right? So we're going to talk about the origin of the nerve, the course of the nerve, the structures that are supplied by the actual accessory nerve, and then clinical correlations of this nerve. All right, so first things first, the main motor nucleus of the accessory nerve is located within the medulla. There's a special structure in here. We're going to talk about it. In the medulla, there's a special nucleus here called the nucleus ambiguous. I'm going to put NA there, right? And it's not for Narcotics Anonymous, that's for nucleus ambiguous, all right? So the nucleus ambiguous is a very, very important nucleus because from the nucleus ambiguous, you're going to actually have the glossopharyngeal nerve come out of this. You'll have the vagus nerve come out of this, and even the accessory nerve, but very, very specific here. The accessory nerve, the cranial part of it. So there's a cranial part of the accessory nerve, and there's a spinal part of the accessory nerve, and we'll talk about both of those. Okay, so from the nucleus ambiguous, you're going to have these rootlets, about 8 or 10 of them, coming out of the nucleus ambiguous. Now, there's a special structure here, this cranial part of the accessory nerve. It runs through a very special hole within the skull. And what is this hole here called? There's a hole right here that it moves through in the skull, and this hole is called the jugular foramen. So this nerve right here, cranial nerve 11, so we'll put here cranial nerve 11. This is the cranial part of the accessory nerve, and it's going to run through the jugular foramen. Some of the fibers here, right? Well, all the fibers will move through here. But there's another nerve that's moving with it. Let's do this nerve in green. It's also going to be having its rootlets coming out of the nucleus ambiguous. And it's also going to be moving through the jugular foramen. Now what happens is this nerve right here, this green nerve, is the vagus nerve. So what is this nerve? Cranial nerve 10. Cranial nerve 10 is important because it goes to supply a lot of the muscles of the pharynx. So it's going to have what's called a pharyngeal plexus, right? So it's going to have what's called a pharyngeal plexus. What happens is some of these fibers, almost most of them, almost a lot of them, this cranial part of the accessory nerve is going to be moving with the vagus nerve. They're going to move together, and they're going to become a part of the pharyngeal plexus. Okay, so again, nucleus ambiguous gives off the accessory nerve and the vagus nerve. They both move through the jugular foramen. Almost all of the actual cranial part of the accessory nerve gives off its branches to move with the vagus nerve. Now, they run in a structure together. It's actually called the carotid sheath. So they actually move through a structure here together called the carotid sheath. So imagine it like this. This whole thing right here is called the carotid sheath. And the carotid sheath is going to be having this nerve run this way, right? Now it's also going to be running nearby other structures. So you know there's going to be other structures moving in this area. You'll also have what's called the internal carotid artery moving nearby. And you'll have another vein. You'll have a vein actually moving by also. There's going to be a vein right here called the internal jugular vein. So what is this vein right here? This is called the IJV, internal jugular vein. And this guy right here is called the internal carotid artery. It's going to be running right near these guys. Okay. Then what happens is this structure here, the running within the carotid sheath, what is this going to do? Okay. These fibers here, these green fibers of the vagus nerve, and moving with it, these blue fibers, form part of what's called the pharyngeal plexus, which is also going to have another nerve that it'll move with it. I'll just throw it in here as a side. This is cranial nerve 9, the glossopharyngeal nerve. It's also going to move with this as a part of the pharyngeal plexus, and it's going to go and supply a lot of the pharynx. So let's actually show you what happens here. So a lot of this structure here are going to come here, and they're going to supply the actual pharyngeal constrictor muscle. So you see this green tube right here? This green tube is the pharynx. There's muscles that are wrapping around it called the superior, middle, and inferior constrictor muscles. What happens is this pharyngeal plexus is going to supply those muscles, the superior, the middle, the inferior pharyngeal constrictors, right? That'll be supplied by this pharyngeal plexus. Another thing here is that you see this actual glossopharyngeal nerve, it's going to be picking up sensations. If you remember, it was picking up general visceral afferent sensations from the oropharynx and laryngopharynx. So this is going to be a part of the pharyngeal plexus. it also will supply another structure here. If you remember, this will also go up to the soft palate. So also here, it's going to go up to the soft palate and supply a lot of the muscles of the soft palate. Like what kind of muscles? It'll supply many different structures of this area. It'll supply, for example, it'll supply the salpingopharyngeus. It'll supply the palatoglossus. It'll supply the palatopharyngeus. It'll supply the levator villi palatini. It'll even supply other different muscles of the uvula, like the muscles of the uvula. So many different muscles there. So again, what is this pharyngeal plexus doing? This whole thing here, which is made up of what nerves? It's going to be made up of the glossopharyngeal nerve, right? It's going to be made up of the vagus nerve, and it's going to be made up of the accessory nerve. And what is this supplying? It's giving supply to the pharynx, right? If it's the glossopharyngeal nerve, it's giving a sensory supply from the mucosa. If it's the vagus nerve, it's going to be running with the accessory nerve and giving branches to the what? The pharynx, primarily the superior, middle, and inferior pharyngeal constrictors, and it's also going to move up to the soft palate and supply the salpingopharyngeus, the levator villi palatini, what else? The palatopharyngeus, the palatoglossus, many, many different muscles in that area. Okay, then what else? You know, from the cervical part of the spinal cord, if we come down here for a second, and there's different parts of the spinal cord. For example, let's say that this is C1. Let's say that this is C2. And we'll just keep going down. C3, C4, and then here we'll say C5, right? There's something very interesting that happens. You know, if I were to take a cross-section of the spinal cord here, let's say I take a cross-section of the spinal cord here, and I look at this, and you know that when you're looking at a spinal cord, you have here the anterior gray horns, right, which are the cell bodies of the somatic neurons. Here's the posterior gray horn, which are the cell bodies of the sensory neurons. And then over here, what are you going to have? You're going to have what's called this lateral white column. They also call it the lateral funiculus. So over here, you might have the lateral funiculus. And then you're going to have the anterior funiculus, right? You hear the anterior white column, right? So here's your anterior white column. I'll put anterior white column, anterior white column. And here's your dorsal white column, right? Something very strange happens within this part of the cervical region of the spinal cord. Coming off the lateral funiculus, you're going to have these fibers coming outwards and then moving upwards. So coming out from the lateral funiculus, you're going to have these fibers that are coming outwards and moving upwards. And what happens is, if you remember, let's do these in this bluish color here. Actually, let's do it in this normal blue here. If you remember, coming off of this right here, you're going to have the ventral root, then you're going to have the dorsal root here, and then these guys will come together, right? And then they'll form what's called the ventral ramus and the dorsal ramus. This lateral funiculus is moving right between these two. So how is it moving? It's actually moving behind the ventral root and anterior to the dorsal root. So it's moving up like this. So this like structure that's coming from the lateral funiculus is moving upwards like this. So how can we say it? We could say coming from here, we're going to have this structure coming from the lateral funiculus of C5. We'll have structures here coming from the lateral funiculus of C4. Structures here coming from the lateral funiculus of C3. Structures here coming from the lateral funiculus of C2. And structures here coming from the lateral funiculus of C1. And again, what are they moving in between? They're moving between the anterior root and the dorsal root. Also, you know what else other structure is going to be right here? The denticulate ligaments, the pia-mater extensions. So they're going to be just behind the denticulate ligaments. So they're going to run just behind the denticulate ligaments, and they're going to run in between the anterior root and the posterior root of the actual spinal nerves, right, that are coming out. Cool. Now what happens? They move upwards, right? As they move upwards, they move through a big old hole right here that would actually be wrapping. I'm just going to draw it kind of small right now, but let's say here's this hole that it moves through. And it's that big old hole in the skull, and this is called the foramen magnum. So it moves through a structure here called the foramen magnum. And what is moving up through the foramen magnum? This spinal part of the accessory nerve that's coming from the C5, C4, C3, C2, and C1 from the lateral funiculus, moving upwards in between the anterior root, the dorsal root, and behind the denticulated ligaments. As it moves upwards, it moves through the foramen magnum into the posterior cranial fossa. When it moves up into the posterior cranial fossa, it'll move through the same hole as the cranial part of the accessory nerve. So what is this blue part here? It's the cranial part of the accessory nerve. What's this red one here? That's the spinal part of the accessory nerve. It runs through the foramen magnum. And again, what happens here? Now these guys are going to move together. Now here's where we got to be a little bit more specific about what that branch is that moved with the vagus nerve. Because right here, this red part here and this blue part there, that is the accessory nerve. But it gives off two branches. This branch here that moves with the vagus nerve, what is that branch called? This branch here that moves with the vagus nerve within the carotid sheath is called the internal branch. Okay, that's the internal branch of cranial nerve 11. This branch here, that's moving with the spinal part of the accessory nerve, and a very, very little fibers from the cranial part of the accessory nerve is the external branch of the accessory nerve. So now this right here is the external branch of cranial nerve 11. Now, when these guys move out, they move together, and they'll also move where? In between the internal jugular vein. They move in between the internal jugular vein and the internal carotid artery. Then what happens is they'll continue to move forward. So let's actually show them moving forward here. They'll continue to move forward here. And what they'll do is they'll move right over the actual atlas. So then once they move through the internal carotid artery and internal jugular vein, they'll move over a special part on the cervical vertebrae. Obviously it would be over here, but we're trying to show it going to another area. But it'll move over a specific part called the transverse processes of atlas. Then there's another bone. Imagine there's like a bone here, a little stylus-like bone. This is called the styloid process. It runs beneath the styloid process. It also runs, there's another artery that actually kind of runs around this area called the occipital artery. So there's an artery here called the occipital artery. And then there's other muscles over here called the digastric muscles. What happens is the accessory nerve is going to move beneath the styloid process, beneath this kind of like occipital artery, beneath the digastric muscles, and then it's going to pierce a special muscle over here. So let's actually kind of show it like this. It's going to pierce a special muscle over here. And this is going to be called the sternocleidomastoid. So what happens here? There's going to be the external branch here, which moves in between the internal carotid artery and the internal jugular vein. It moves over the transverse process of atlas. It runs beneath the styloid process, the occipital artery, and even the digastric muscles here, primarily like the digastric posterior belly. So if you really want to remember it, there's a muscle here called the digastric posterior belly. It moves beneath that. And then these nerves are going to run together, right? This spinal part and then the cranial part, which is forming this external branch. And they're going to go and they're going to supply what? They're going to supply the sternocleidomastoid. So they're going to pierce the sternocleidomastoid and supply the sternocleidomastoid. Okay, that's the external branch. Like I said, the internal branch will run with the vagus nerve in the carotid sheath with, it'll also gain a branch from the glossopharyngeal nerve. They will go together as what? What is this big old structure here that I've talked about? What is this structure here of them moving together? This is a part of what's called the pharyngeal plexus. Now, when I show the pharyngeal plexus, most of the motor fibers of the vagus nerve that's actually going to the pharynx is really from the accessory nerve. So again, when I show the vagus nerve here running, I'm just doing it to show that it's actually moving here, but most of the fibers that are actually going to be supplying the muscles of the pharynx and the soft palate are going to be the motor fibers of the accessory nerve. And the accessory nerve, the internal branch, moves with the vagus nerve, the glossopharyngeal nerve, and the glossopharyngeal nerve supplies general visceral afferent, so sensations from the mucosa of the pharynx, and from the soft palate, a little bit of the actual posterior 1/3 of the tongue, right? And then this vagus nerve, that's actually really moving with the motor fibers of the accessory nerve, is going to go and supply the superior, middle, inferior pharyngeal constrictors. It'll supply muscles of the soft palate, like the salpingopharyngeus, the actual what? palatopharyngeus, the palatoglossus, the levator veli palatini, many, many different muscles of the pharynx, as well as even the muscle of the uvula. But now we have the external branch that we showed going this way, right? And it goes to the sternocleidomastoid. So now, here's what gets really interesting from the sternocleidomastoid, right? I'm going to put SCM. Something really interesting happens here. From C2 and C3, I'm actually going to do this in this like doo-doo brown color here. From C2 and C3, you have their ventral ramus, right? So you have their ventral ramus from C2 and C3. These guys are going to move with the accessory nerve, right? And give off their branches to help to supply the sternocleidomastoid. So what do we have here? We know that the external branch is containing the cranial part and the accessory part. Most of it is the actual spinal part, right? The spinal part here is the accessory nerve. So most of it that's coming up together here is going to be the spinal part of the accessory nerve and the cranial part of the accessory nerve. Most of the fibers branch and go into the internal branch. Very little of them go into the external branch. Along the way, they pick up fibers from the ventral ramus of C2 and C3 specifically to go to the sternocleidomastoid. Now, after that, some of these fibers will pass out of the sternocleidomastoid and then move over another muscle that will be right in this area, like the levator scapula. And then it moves over a special area here. I'm kind of going to make like a triangle here, like a special triangle here. I'm going to make a triangle right here on the side of the neck here. There's this specific area on the neck called the posterior cervical triangle. So again, what muscle? It'll come out of the sternocleidomastoid. It'll supply another muscle. It'll move over another muscle called the levator scapula. Then it'll move into what's called the posterior cervical triangle, or the posterior triangle of the neck. Then it'll come out of that area and supply the trapezius. Okay, so it'll supply the trapezius muscle. So what is this muscle right here called? This is called the trapezius. Something else weird happens here too. And again, what else would be coming here? If we're looking here, we're also going to have these fibers moving this way, just for the sake of being consistent. But now something else weird happens. Another ventral ramus, particularly from C4. So from C4 comes out here. And this contributes. So from C3 and C4, you're going to have another branch here. And this is going to go and supply the trapezius. So the trapezius is getting branches from C3 and C4. It's getting contributing branches from C3 and C4. The sternocleidomastoid is getting contributing branches from C2 and C3. Okay, let's go ahead and review this one more time so that we can make sure it's very, very clear. Okay, first thing, nucleus ambiguus, right? Nucleus ambiguus is going to be the origin for the cranial part of the accessory nerve. Then what happens to that cranial part? It moves through the jugular foramen with the vagus nerve. What about the nucleus that is for this, or the origin of this spinal part of the accessory? Remember, it was coming from the lateral funiculus. It was doing something very, very odd, and it was coming from the lateral funiculus and moving upwards. And this is forming the spinal part of the accessory nerve. That moves up through the foramen magnum and goes through the jugular foramen. As it goes through the jugular foramen, the whole thing is the accessory nerve now, but it gives off two branches. One is an internal branch that moves with the vagus nerve within the carotid sheath, in between the internal jugular vein and the internal carotid artery. It picks up the glossopharyngeal nerve and becomes a part of the pharyngeal plexus. Basically, what is this internal branch of the accessory nerve doing? It's basically giving most of the motor fibers for the vagus nerve, which is going to go and supply the superior pharyngeal constrictors, the middle pharyngeal constrictors, the inferior pharyngeal constrictors, the salpingopharyngeus, the palatoglossus, the palatopharyngeus, the muscles of the uvula, the levator veli palatini. Okay? Then, the external branch will pick up very, very few fibers of this cranial part of the accessory nerve. Most of it is going to be the spinal part of the accessory nerve. It's going to run, again, in between the internal jugular vein and the internal carotid artery, over the transverse process of atlas, beneath the styloid process in the occipital artery and the digastric posterior belly. Then what happens? It's going to pierce the deep part of the sternocleidomastoid. It's going to give the sternocleidomastoid innervation. Along the way, it's going to pick up motor fibers from the ventral ramus of the cervical region of the spinal cord from C2 and C3. After it supplies the sternocleidomastoid, it moves over the levator scapula, past and goes through the posterior triangle of the neck, or the posterior cervical triangle, and goes and supplies the trapezius muscle. Along the way, though, to supply the trapezius muscle, it picks up ventral ramal fibers from the C3 and C4 region of the spinal cord. Holy crap, we got all of it, right? But now, there's also something else. You know, within the cortex, we have what's called corticobulbar fibers. The cortex also gives supplies to the accessory nerve. So you know in the cortex we have a specific area, we're going to say it's like right here. We're making a coronal section of the cerebrum. Let's say up here is going to be the, specifically let's say this is the frontal lobe, and let's say this is like a part of the temporal lobe here, right? This guy here, you're going to have a specific area called the precentral gyrus. So you have this area here called the precentral gyrus. And in the precentral gyrus, there's going to be the cell bodies of these motor neurons here, the upper motor neurons basically. And the precentral gyrus has these motor neurons, and it's actually a part of what's called the primary somatomotor cortex. What happens is these fibers can actually come out and then move downwards. Same thing over here. This would be on the actual other side here too. So let's say here I have some part of the actual precentral gyrus from the primary somatomotor cortex. Remember, not somatosensory, somatomotor. And these will move downwards. As they move downwards, what will happen here? They'll come over here and they will give a little bit of connections to the nucleus ambiguus. They'll give a little bit of connections to the nucleus ambiguus. All right, so if we come down here with these corticobulbar fibers, they'll give connections to the nucleus ambiguus. But most of them will continue to move downwards even further and go where? They'll go to supply C2, they'll go to supply C3, and they'll go to supply C4 to activate those motor neurons within the ventral ramus, right, of C2, C3, and C4. Remember, C2 and C3 contribute to the sternocleidomastoid, and C3 and C4 contribute to the trapezius muscle. So it'll also activate this. Here's what's a little weird though. If I draw kind of another little quick cross section here, let's say I draw a little cross section of the spinal cord here. And let's say here, again, I have my anterior great horn right there, right? Let's say the corticobulbar fibers are coming downwards, right? So let's say here's my corticobulbar fibers. When they come down to the actual cervical region of the spinal cord, some of them will cross to the other side and activate those motor neurons that come out. Some of these will actually cross too, right, and go out. But here's what's really weird. Let's say that this is at the C3 and C4 region. So most within the C3 and the C4 region. So the ones that are going to the trapezius is the ones that are going to be contralateral. So going to the trapezius, most of the fibers are going to be contralateral. However, the ones going to the sternocleidomastoid are very, very weird, and these fibers are not going to cross. They are going to be ipsilateral. So for the sternocleidomastoid, those fibers don't really cross. They remain ipsilateral. But for the trapezius, most of the fibers cross, and they are going to be contralateral. Contralateral. Just so that we apply that concept. So the corticobulbar fibers, what are these fibers here called? They're called corticobulbar fibers. If they're going to the trapezius, they'll actually cross and so go to the C3 and C4 nerve root, right? But the ones that are going to the sternocleidomastoid, specifically around C2 and C3 region of the spinal cord, for some weird reason, they stay on the ipsilateral side. Okay. Why am I mentioning all this? Because lesions can occur at different points along this area, right? You could develop a lesion right here, within this part. You could develop a lesion of the nucleus right here. You could develop some type of lesion within the parts of the spinal cord. You could develop lesions along the actual peripheral processes that are going out to the sternocleidomastoid out here, right? Many, many different things could go wrong. You could have a lesion of the corticobulbar fibers, maybe due to some type of infarction of some type of vessel in that area. You could have some type of issue here where you might damage the nucleus for whatever reason, right? Maybe some type of tumor, maybe some type of abscess, maybe some type of infarction of a vessel that's actually coming up to supply that area. There could be many different things. You could have a spinal cord lesion, you could have ALS, you could have polio, you could have some type of motor neuron disease. Even the exit, as it's exiting out of the skull, there could even be problems here too. Even as it's exiting out of the skull, there could be problems. You could have metastatic lesions at the base of the skull, like we talked about with the glossopharyngeal nerve, maybe a chordoma, a cholestoma, maybe some type of lymphoma, a bronchial cancer that spread, maybe even a breast cancer that spread, right? Could be many reasons. Also, if you have severe blunt force trauma to the neck region, that could also damage the accessory nerve. Another weird thing about the accessory nerve is, you know, you have these things called your cervical lymph nodes. So you have these structures in this area here called the cervical lymph nodes. And the cervical lymph nodes are in very close proximity to the accessory nerve. Why is that important? Let's say that you develop an infection or you have lymphoma and this actually starts getting swollen. As it starts getting swollen, what can happen then? It can start actually compressing on the accessory nerve. Or let's say that you do have a tumor and they have to go in and do some type of biopsy or radical neck dissection or radiation therapy. That could also damage the accessory nerve, right? Again, there could be other reasons for this. Also, you might even have some type of demyelinated condition of the accessory nerve. Maybe some type of demyelinated condition like maybe Guillain-Barré syndrome, right? There could be many different things that are affecting it. Maybe even an internal carotid artery aneurysm could compress this actual nerve. So we could keep going on and on and on of things that could happen. But even with all of this said, what would be the devastating effects of having the accessory nerve palsy? If the nerve is actually hit, like proximal part of it, right, before it actually goes and specifically, here's the reason why I mentioned this posterior triangle of the neck. Because let's say that I damaged it before it goes to the posterior triangle of the neck. Let's say that for whatever reason here, I damaged the accessory nerve right there. What's going to happen? I'm going to have SCM weakness. Okay, sternocleidomastoid, what does it do? It's important in flexion, and it's important with the kind of an ipsilateral kind of movement of the neck like this. But it turns the head to the contralateral side. So me doing this, let's say that I damage the right accessory nerve, right, going to the sternocleidomastoid. If I damage that, I can't move my head to the opposite side. Another thing is, let's say that I damage the trapezius. If I affect the fibers going to the trapezius is important for elevation of the scapula. It's important for retraction of the scapula. And it's also helping to stabilize the shoulder joint area. So what happens? If that's damaged, the shoulders will start drooping. They might have upper mild scapular winging. So the scapula might wing, and it also might be laterally displaced. So that could be a problem. And also, since it is around the shoulder joint, they might have a hard time being able to abduct their arms or even elevate their arms above the horizontal. That's why I'm telling you that. But let's say that for whatever reason you develop some type of lesion or damage or tumor or some type of situation that damages the nerve fibers within the posterior triangle of the neck. Why is that important? Because then the SCM fibers are spared. These fibers of the trapezius are not. If this is damaged, your SCM might function properly, but the trapezius might not function properly, okay? So that pretty much covers everything that we would need to know about the accessory nerve, okay? We'll talk more about how the pharyngeal plexus is affected during the vagus nerve, but for right now, I want you guys to basically understand the most important thing about the accessory nerve is its supply to the trapezius muscle and the sternocleidomastoid. All right, so I hope all of this made sense, Ninja Nerds. I hope you guys enjoyed it. If you guys did, please hit the like button, comment down in the comment section, and please subscribe. As always, Ninja Nerds, until next time.